As we enter the month of June, Malaysia faces the most critical phase in our fight against COVID-19. Case numbers have surged, our health system is strained, and we are now exposed to new variants of the virus that are more aggressive and transmissible. We all know lockdowns are costly for the economy. Although we have no choice but to implement an MCO now, we cannot continue to do so in the future. Millions more will lose their jobs and livelihood. That is why we need to vaccinate everyone at a faster rate. Although the initial plan was to vaccinate 80% of our population by the end of the year, the Prime Minister has instructed me to get this done much quicker. We have renegotiated our delivery schedule so that vaccines will arrive faster. We will receive the entire 12 million doses of our Sinovac order by the end of July, and we will receive 25 million doses of the Pfizer vaccine in the third quarter of this year. Our pharmaceutical regulator is also quickly evaluating the CanSino single-dose vaccine. We are also increasing our vaccination capacity as well. We are now hitting 100,000 doses a day. We want to double this by July. We are adding more vaccination centers or PPVs, including mega PPVs that can handle 5,000 to 10,000 doses a day. I know people are concerned about crowds at mega PPVs. I have instructed strict SOPs and crowd control measures so overcrowding is minimized. We are increasing the number of GP clinics that will also become PPVs. By the end of June, 1,000 GP clinics will be doing COVID vaccinations, making it easier for people to access vaccines. More private hospitals are also being used as PPVs. Drive-through PPVs will also be open. Mobile outreach teams have also been set up at the state level. These teams have been and will be mobilized to care homes for the elderly and disabled, kampongs, homeless shelters, orang asli villages, and difficult-to-reach areas so that no one is left without a vaccine. I am also visiting the states to coordinate with state governments on this accelerated rollout. We will empower the states and districts to implement the vaccination program in order to overcome their unique local challenges. We will also start to vaccinate industries and economic sectors that have to remain open during the MCO. This is important because we know the virus spreads with greater mobility. People who are out and about working need to be vaccinated to protect them and everyone else. I understand the frustration from everyone waiting for their turn to be vaccinated. With a rising number of cases, there is greater urgency. The COVID Immunization Task Force will continue to accelerate our rate of vaccination to ensure we can protect as many people as possible, as quickly as possible. Thank you.